Welcome back to Free Media. I'm Amber Duke.
And I'm Robby Soave. Well, MSNBC's Rachel Maddow recently bashed President-elect Donald Trump's top pick for the National Institute of Health, Dr. Bhattacharya, criticizing his stance on COVID lockdowns.
On the heels of Donald Trump picking him to run Medicare and Medicaid in this country, we also got news on other healthcare picks to run the CDC. Donald Trump picked a former Republican congressman who for years has crusaded on the false claim that vaccines must be the cause of autism to lead the National Institute of Health. Trump's top candidate endorsed herd immunity as the best way to address the COVID pandemic. Just a fancy way of saying, let's get everybody sick and see what happens. Cull the weak, cull the elderly. Now we know that the vaccines work well enough that the virus stops with every vaccinated person. A vaccinated person gets exposed to the virus does not infect them. The virus cannot then use that person to go anywhere else. It cannot use a vaccinated person as a host to go get more people. That means the vaccines will get us to the end of this.
Dr. Bhattacharya responded to Maddow's criticism on X, writing, quote, Maddow is lying about the Great Barrington Declaration. It advocated for focused protection of the elderly and vulnerable. It's the lockdown strategy she espoused that led to the calling of children, of the poor, and the vulnerable. Has she ever heard of Sweden? End quote.
Look, and I wish it was the way Rachel Maddow had insisted in that clip, that if you get the vaccine, you're not able to get COVID, but it turned out that was not the way it works. Turns out it works the way, and this could have been predicted, as the flu vaccine doesn't stop you, hasn't eradicated the flu, and wouldn't even if we all got it, because it doesn't stop you necessarily from getting it. It has a mildly protective effect, as does the COVID vaccine. So does getting COVID. That has a mildly protective effect on getting that same strain for some amount of time. The idea with herd immunity, this is exactly what it came to. I mean, they were right that this is too contagious to stop with whatever interventions you want. Even the countries that went way farther, with zero COVID lockdown forever type stuff, eventually they lamented, they gave in, and waves of COVID swept through their societies. To even the island nations that tried to stave it off as long as they could, they all got it too. And if you are in a vulnerable medical situation, if you're an elderly American, if you're severely obese, it's great for the vaccine to be available to you to reduce your odds of very serious illness or death. It is not going to stop the virus itself. That it was the case that it was going to move through our society, and we should take whatever efforts we can to protect the people most at risk, including with vaccines where appropriate. But that was the strategy we ended up going with, because that was the only reality in the face of COVID.
Exactly.
What they believed didn't work.
Yeah, I mean, you had people within the Trump administration from the health bureaucracy, like Dr. Fauci and Dr. Birx, who came up with this grand scheme that everybody had to mitigate risk as much as possible, pay people to stay home, prevent even otherwise young and healthy people from living their daily lives and potentially catching COVID, because they thought they could just stop everybody from getting it.
And first, that was for just a brief amount of time. They said, we're just doing this until we get our hospitals ready to deal with COVID patients. I said, okay, that sounds reasonable. Then it was, no, we're doing this until the vaccines are available. I'm like, okay. They're like, and now we're doing it until everyone gets the vaccine. Okay. Now we're doing it, until there's no COVID. But that's never going to happen. Oopsies.
And now you hear these people say, well, we didn't really know, and nobody could have predicted. But there were people saying it from the start that it's not going to stop you from getting COVID. You had Dr. Bhattacharya, Dr. Scott Atlas saying from the beginning, advising the Trump administration that this was the right policy, protect the most vulnerable, allow everybody else to live their lives. Sadly, people are going to get COVID. That's just the reality of the situation. But you build up herd immunity among the population that is at the least amount of risk for a serious side effect or death. And then by the time you get the herd immunity among that population, you probably have a vaccine or therapeutics that can help people who are more vulnerable. And instead, we took the most extreme approach, which of course led to massive learning loss with children, people losing their jobs, massive side effects from people not going to the hospital for preventative screenings and care for cancer and things of that nature, people developing depression, alcohol and drug abuse disorders. I mean, it was an unmitigated disaster.
Now you're just describing me. No, I know we kept locked up young people. The most the least at-risk population
the
were the people who had to deal with pandemic mitigation for the longest. I mean, that on its face makes no sense because, unfortunately, that was the area that Democratic Liberal Teachers Union had the most control over was the education sector. And so you got the kind of governance kind of policy that progressive people wanted for everyone. You only got it for public schools. That's what they wanted for everyone. They only got it for public schools. For the group it made the least sense to do that for, right? We should have thought through, and I'm not saying it would have been easy, but we should have concentrated on our efforts. How do we keep people in nursing homes safe rather than sending people who were stable but still positive for COVID back into nursing homes, as was done in New York, in my home state of Michigan, and elsewhere under federal policy, but that the states went along with. Under Minnesota, Tim Walz said that it was still the right policy, even after knowing the catastrophe that caused. That was a choice.
And Dr. Bhattacharya brings up Sweden in his response, which is the perfect example because they put kids back in school almost immediately and chose this alternative route. And I remember early on, everyone was having a meltdown. Oh my gosh, Sweden's case numbers are so bad. But guess what? They got through the worst of it way quicker than the rest of us did. And they don't have all of these outside factors, particularly learning loss among children, that we experience in places like the United States and elsewhere in the UK and in Europe, because they were brave enough and courageous enough to do what the science said, which is that this was something that is most dangerous to people who had multiple comorbidities.
Yes, exactly. And you didn't see, all those interventions, of which the states took a variety of approaches. You didn't see a big difference, for instance, between red and blue states in deaths and severe illness throughout the lockdown phase and the masking phase where people pursued different strategies, because all of that just did not amount to enough difference. You did start to see difference emerge as people who could have been protected, older Americans, more ill Americans who, if they'd gotten the vaccine, might have had a better outcome than not getting it, and then you did start to see a difference. But up until that point, all of that other stuff, it just didn't amount to very much.
And they forced people to get the vaccine who already had natural immunity, which most studies indicated was actually stronger than the immunity that you would get from the vaccine.
Yeah, I mean, the evidence was not, the forcing people to get vaccinated was sold on a lie, which was that this is to prevent other people from contracting COVID. It was sold on that basis as a public health measure, when the reality is, no, it's for your own, if you're, again, a vulnerable American, I still think you should be able to choose it for yourself. It shouldn't be forced on you, but it's the primary benefit is for the person getting it, not for the public health benefit. And yet the Biden administration, Biden administration was going to require truck drivers to get it and all of that kind of thing. So bad policy, and I do hope Jay Bhattacharya is the man for that job.
He's a great pick.
More free media right after this.